Well, today is Valentine's Day, and usually on Valentine's Day, a lot of things occur. But here on Oprah, we wanted to bring you something a little special. It's called The Matters of the Heart. In 2008, more than 600,000 people died due to heart disease. Today, we've got Dr. Ulrich Jorde, cardiac transplant specialist. He's here to discuss the consequences as well as the treatments to heart disease. Also, we've got registered nurse Carolyne Castillo. And we also have two recipients who are joining the show, and they're heart recipients, and they're Marianne Gaffney and John Lewis, and they're going to share a little bit with us today. And Dr. Jorde, thank you so much for coming and sharing with us.
Thanks for having us.
Thank you all, actually. How are you guys doing?
Good.
Happy Valentine's Day.
Happy Valentine's
So I
Day.
told people this would be a little bit different because, you know, on Valentine's Day, of course, it's about the heart.
Yep.
And we know that heart disease is something that affects a lot of people, but you guys are doing something pretty unique.
Yeah, you know, Valentine's Day is the day of love, and what we're talking about today is advanced heart failure that many Americans die of every year. And what we can do at the time point where medications fail, we can begin to replace the heart. Heart transplantation, most people are familiar with, and we have one heart transplant recipient here, Marianne Gaffney, who received a heart transplant at Montefiore about 4 months ago, I believe.
Yeah.
I don't remember the exact date. That's
Right.
good. And we also have John Lewis here, who has actually received what you can refer to as an artificial heart. And I have here in my hands components that Mr. Lewis wears on his body to power a small pump about the size of an egg that provides about 6-7 liters of blood flow to his body until he will receive a heart transplant. These procedures have become routine. At Montefiore, we do hundreds of transplants a year and about one heart transplant a week. And we're also a leading center in the US on these so-called left ventricular assist devices that you can get nowadays either to wait for a heart transplant, maybe Mr. Lewis can speak himself a little bit of his experience, or as what we call destination therapy, if for some reason you are not a candidate for a heart transplant.
Okay, let me go first round horn. Marianne, you just had one recently.
October 30th.
October 30th. What's life been like for you since then?
It's been wonderful. I got out of the hospital November 7th, which is amazing. I've been staying with friends and just trying to get back to normal activity.
How do you feel now?
I feel good. I feel really good. I feel very blessed to have received a heart. You know, I feel blessed to have a family that was kind enough to donate it to me as well.
And John, for you, I know that we talked a little bit before, and understanding doctors giving us a little bit about your story. Talk to us about it.
Well, I have my LVAD for about 3 years now, and life has changed. You know, I feel a lot better when I first met Dr. Jorde. I agree with her as far as, you know, life-changing experience. You know, you learn to appreciate what you have. You don't know it until you're about to lose it.
And with this experience of having actual, literally, you're walking with the device daily, how does that impact what you do? Do you feel any change in your day-to-day activities?
No. I'm an avid golfer, a 10 handicap.
What?
I'm also in a bowling league. I also fish, and my hobby is photography. I keep myself mentally busy. There are some challenges, you know, there are some challenges out there that you have to deal with. But you adjust. You know, you adjust to it. And I thank Dr. Jorde, especially my coordinator. You know, she's one of the best. All I can say is I really can't, I won't say I can't function without her, but she's a lot of support. She gives me a lot of support.
And Carol, talk about that because as he talks about the support, talk about the support that's offered through what you do.
Well, you know, we spend a lot of time with our LVAD patients, and we develop a relationship that's very trusting. So the patients feel comfortable coming to us with any questions or concerns. You know, Mr. Lewis also is an advocate for the LVAD community. That's one thing he didn't mention that he does as one of his hobbies. Whenever we have a patient that's about to get a procedure that's very questionable about whether they should move forward, Mr. Lewis is always available to provide his story and to give them a background on really what happens throughout the process and after surgery and how it changes your life. And I'm just there, you know, to communicate with him and to make sure that he's able to do the things that he needs to do with his life to move forward, because eventually he will get a transplant. And the LVAD is really there to keep him healthy enough until that time comes.
Talk about nervousness, because you talked about that. Talk about the nervous process. I mean, a lot of people, as you say, this is a common procedure, but to an individual, it's a once in a lifetime experience. Nervousness going in?
Absolutely, but I had the LVAD first, and it really didn't agree with me. It would beep all the time, and it was a little scary. The nurses would run in, the doctors would come in, and so when I was told I had a heart, that was just overwhelming. My family was there supporting me, but of course you're nervous, but I knew I had a new leash on life. So I was very fortunate, and Dr. Jorde and his team are amazing. They walked me through every step of the way, and it's funny now because you go into an operating room awake. So it's kind of weird.
Yeah.
But I had full trust in them. I had been there from the end of September till November 7th. So I had been there quite a while, and I had just a great relationship with everybody. So
Let me just clarify one quick thing. Common. Heart failure is extremely common, with 6 million Americans getting it. We see about 10,000 visits a year at Montefiore. For our center, transplant is routine, but of course that's not a very common occurrence. It only happens about 2,500 times in the United States every year. We happen to be a very experienced center for both procedures, with an extremely experienced surgical team that actually placed the devices. My principal partner, Daniel Goldstein, is one of the leading surgeons in the world. So common for us, but not a common procedure in the US, where probably 10th, if not 100,000 patients get heart surgery every year. But transplantation is still rare, and part of that is that we do not have enough organs. A lot of people, about half of all Americans are organ donors. That's terrific. The other half, hopefully, is watching. And New York State actually has a low organ donation rate because New Yorkers are less likely to sign up to become organ donors than people in other states.
And before we go again, please lift up the device. We talked about it before, but let's talk about it again.
Right, so here's the, this is a little computer that Mr. Lewis has right on his belt over there, and he has 2 batteries that he's carrying. And a cable about this thickness goes into the wall of the belly to a pump that is about as big as a big egg, I would say, that is connected, that the surgeons connect right to the heart, that then pumps instead of the heart about 6-7 liters a minute. This procedure has now been done 30,000 times, in the whole world, and America and in Germany are actually the 2 countries where it's most commonly performed. In the US, this is done about 5,000 times a year. The most important thing is when we have to do this, fortunately we do it well. But the most important thing is to come to attention early to avoid needing something like this. There's excellent medical therapy out there right now. There's excellent pacemaker therapy that we like to employ to avoid this stage.
I'm going to let you get the last word in this segment. Talk a little bit about, just real quickly, so after a person has the surgery, you do a lot of work with them afterwards in terms of counseling and what's available?
Yes, after the patient has the surgery, they're in the hospital for maybe about 3 weeks on average, and we spend that time not only educating them on the LVAD and how to take care of it for themselves, but also a family member. Because you always want to have the support of somebody at home. So we teach them both how to take care of the device, how to take care of themselves, and we let them know what to expect even before surgery.
Well, I want to thank you all for coming and sharing with us, and congratulations on the surgery. Wish you the best. When I heard that you said you were a golfer, I was like, I was excited. I was ready to go out and play. Then you said 10 handicap. I was like, I can't mess with you. So, but best wishes, and thank you so much for coming to share with us.
Thank you.
Thanks for having us.
Thank you, doctor.
Best
Thank you.
doctor sitting there in front of you.
Thank you. All right, well, listen, we want to tell you this is a heart edition, and it's a matter of the heart. And so if you want to find out more information, please make sure that you check out Montefiore, and they'll give you more information with regards to the LVAC and all that we've just talked about here today. Taking a quick break. We're going to have more shows. Stay with us. We're coming right back, including the fire department. And what are they here to talk about? Helping you. We'll be right back in a few.